a vaccine advisory panel handpicked by the HHS Secretary, Robert Kennedy Jr., voted to end the long-standing recommendation to give all newborns the hepatitis B vaccine. The CDC said more than 6 million cases were prevented by routine vaccines over the past 30 years, but today the panel recommended delaying the dose until a child is 2 months old. Now the recommendation heads to the CDC director for approval. Every single member on this panel was appointed by Kennedy, who pushed unfounded conspiracies about vaccines in general for decades. I want to bring in CNN medical analyst, Dr. Jonathan Reiner. Doctor, thank you so much for being here. I want you to help us understand why the CDC is scrapping this Hep B shot for really just 2 months, from being a newborn to 2 months old, which is, I mean, for moms, I will say 2 months is still pretty much a newborn. Why does it matter?
Well, it matters because newborns can get hepatitis B from their mom if the mother has hepatitis B at the time of delivery. So vaccinating kids literally the day after delivery can almost completely remove any chance that that child will get hepatitis. To your first question, why is this being done now? It's being done now because the HHS secretary not only does not believe in vaccines, he believes this vaccine contributes to autism. And there's no data. There's never been a safety signal really for any vaccine, and particularly this one. And in terms of side effects, pediatricians look at this vaccine as unusually side effect free. So by pushing this back at least 2 months and creating doubt in the minds of parents about the safety of this vaccine, this is going to lessen or reduce the number of kids that actually get vaccinated for hepatitis B. Prior to 1991, there were almost 20,000 cases of hepatitis B in kids. In 2020, there were 20. So this has basically abolished hepatitis B for a generation of Americans, and this now is going to erode that kind of protection and result in deaths, needless deaths, vaccine preventable deaths.
It is a recommendation that's changing, but do you expect pediatricians to still recommend to new parents that a newborn get the shot after they're born and not wait 2 months?
Well, I do. The American Academy of Pediatrics in the last 2 months, reinforced their recommendation for what is called universal vaccination for hepatitis B, which is basically to vaccinate every kid the day after birth, regardless of the mom's hepatitis B status. So pediatricians and their society will continue to recommend this. And that's my recommendation to parents. Don't listen to the CDC and HHS anymore. Under this administration, they've become an unreliable source of medical information for this country. Rely on your doctor. Talk to your pediatrician, talk to your OBGYN. That's where you should be getting your medical recommendations.
I mean, I'm sorry, that was a huge statement, particularly coming from you, and you are one of the many physicians who say follow the science, and I guess that's your point. But to hear you, Dr. Reiner, and you've worked with the government for so long, I mean, you spoke so beautifully at Vice President Cheney's funeral as somebody who has worked with government officials at the highest levels of the U.S. government saying, don't listen to the CDC.
Right, because in the past, look, CDC has gotten things wrong in the past. I don't, no government agency, no scientific agency has been perfect, but CDC in the past has used the best science available at the time through subject matter experts to make recommendations. Now vaccine policy is being set by just one man, by a lawyer who specialized in suing vaccine companies, by a vaccine denier, by Robert F. Kennedy Jr. He is dictating vaccine policy to CDC. At the ACIP meeting yesterday and today, no CDC subject matter expert has testified. Vaccine deniers have. So he's made this basically an organ of to disseminate vaccine misinformation.
Well, let me just ask you.
Completely unreliable.
I want to ask you one specific question. One member from Louisiana, Dr. Evelyn Griffin, seemed to be blaming immigrants for Hep B cases. Here's what she said.
We have had years of illegal immigration. undocumented people coming from higher endemicity countries have been through the legal immigration process. And even that is very voluntary in terms of documenting your hepatitis B status, in terms of being tested for it, in terms of even if you want to document it, no one's asking if you are hepatitis B positive or negative.
Your reaction?
Wow. So first of all, what she's basically stating is that a whole group of people are disease carrying. Basically, that's basically the definition of vermin. And as a Jew, that brings back very uncomfortable resonances, with 1930s in Germany, classifying a whole group of people who are in this country now as basically disease carrying. Really unbecoming for a physician. Outrageous.
Dr. Reiner, thank you so much for being here. Appreciate it.
Thank you, Dana.
And I'm joined by a terrific group of reporters here at the table. David Chalian?
I just can't get over that you just heard this respected physician say, don't listen to the CDC or HHS. He's not the only one saying that. I mean, lots of respected physicians are saying that very publicly. And so it does beg the question, like, what this was about. Because do you think if this was completely agreed upon, that we would have seen the delay in September, or that we would have seen the delay yesterday? Or this clearly was not a consensus. And so what it is an ideological push as it relates to science. And those two things, it just seems to me, shouldn't be intermingled here. And it just will inject so much uncertainty, doubt, confusion into something that, an area you just don't want that as a parent. You don't want uncertainty, doubt, or confusion.
Well, and speaking of confusion, on the CDC website right now, it could change, but currently on the CDC website, it says the best way to prevent hepatitis B is by getting vaccinated. Hepatitis B vaccine is safe and effective.
Yeah, I mean, it doesn't seem as though that's going to change, because this isn't about the vaccine in general. This is about when you get the vaccine. And the push hasn't been necessarily, yes, we know that RFK in the past has talked about vaccines and dabbled in conspiracy theories, but this is particularly about children and babies getting the vaccine. So it seems unlikely that they're going to get rid of the vaccine language on the CDC website. But I think, to David's point, what this really does is sow a lot of confusion about anxious parents. I mean, Nia and I were just talking about how you feel when you have your first child or your second child, and you're in there and they're kind of giving you a lot of information, and they come at you with this, this is what we recommend. And now that process is going to get complicated, and you're going to have some doctors and some nurses who feel uncomfortable either saying how they feel or saying the CDC guidelines, and it really muddies the waters at a time where this had been fixed. This was something that years of research were put in place to come up with a solution to help children and to help mothers and families make that decision in that moment. And now that has been stripped away and created a very chaotic and confusing situation.
And Amy, the politics of this are MAHA.
Yeah.
And Make America Healthy Again, and the coalition of people, which really are, it's pretty broad. It's not just, it's a lot of women, moms, but it's not just that, and it's not, and there are former Democrats, former liberal, or maybe even current liberals who are part of this, and they did fuel a lot of support for Donald Trump's re-election campaign.
Yeah, and I think when we think about the MAHA, that is very good to point out that it does span, it's not very strictly ideological.
Not from a partisan perspective.
Not from a partisan.
Ideological on this issue,
Though I think a lot of folks came into it. I've been talking to folks who've been doing a lot of political work with some of these voters, people who are either consider themselves to be part of the MAHA movement or say that they're MAHA curious. And when you look at them, all of them, what does bind them together, not surprisingly, is a skepticism of the healthcare system. And that's understandable. We're all somewhat skeptical of all, whether it is you have your first child and you get all this information coming at you. What does the CDC think? What about these pharmaceutical companies? Who's making money off me? How does the system work? Do I have access? Understandable. Some of it is about they came in through a healthy eating and exercise piece of it. But the one thing that was really interesting about some of the focus groups that this group has done is that even as we say this is very confusing for a lot of people, there is still trust in actual doctors. There is still trust in the system itself. So while they may be skeptical, what a lot of these folks will do is hear recommendations like this and then go talk to their doctor about it. Say, I've heard all this stuff about the CDC. What do you think about this? Or hear something that someone says and then Google it or chat GPT it. So they are not taking necessarily everything that RFK Jr. is saying and making that part of their lives.